A very good afternoon to one and all. I would like to welcome you all to the 90th Continuing Medical Education event organized by the Faculty of Medicine, Bioscience and Nursing, Masa University. On behalf of the CME committee, I'm very happy to welcome all those who are connected today to this event. Today's speaker is Associate Professor Dr. Chitra Govindaraja. We all know Prof. Chitra. She is currently the Division Head of Pharmacology and Therapeutics at Faculty of Medicine, Bioscience Nursing, Masa University. Let me give a brief introduction about Prof. Chitra. Prof. Chitra graduated from Madurai Medical College in 1985, and in 1997 she did her MD in pharmacology from Madras Medical College, and she has over 33 years of academic experience, academic and working experience. And we know that she is the head of assessment in medical education at the Faculty of Medicine, Bioscience and Nursing, and she has done a lot of contributions to the faculty in terms of curriculum development, review, and assessment. She has been a key member in the new policy development to look into the assessment methodologies that's being practiced in our university to improvise the questions to different levels of Bloom's taxonomy of learning. And she has been an active participant in reviewing the learning objectives with the curriculum committee, and she has also been in giving us advices on how to provide feedback to the students and how to act on the external examiners comments, and how to keep on improvising our feedback methodologies, as well as the blueprinting of questions that is done for en bloc exams. So we all are aware. So during the vetting sessions and assessments, we are behind her with taking her advice for improvising all the time. The quality of questions and other things associated with the assessment as such. And Prof. Chitra had been contributing actively to the faculty as such, being a member in the faculty board, and the curriculum review committee, and the student performance review committee, etc. And Prof. Chitra's research interest mainly focuses on medical education, aiming on professionalism and improved quality of life among medical students. And she also focuses on various centered learning technologies like flipped classrooms, team-based learning, etc. And she does have a lot of publications in this area of medical education. Today, she's going to talk about item writing guidelines on MCQs in medicine. I think without delay, I would like to request Prof. Chitra to take over. Prof.
Thank you, Dr. Deepa. Thanks for your kind introduction, and good afternoon, everybody. Now, as the title goes, now the focus today will be on multiple choice questions. We will focus mainly on the single response answers, or otherwise also known as one best answer type of questions. Now, in this session or in this meet, I would just like to share with you the generally accepted criteria in the construction of a well-structured multiple choice question. And this is based on the research over more than 2 decades done by the medical educators. So I have put all the references for you in towards the end of it. So this is just a sharing session with you all, right? And for assessment, all of us have been involved in making questions. And at our institution, we made a transition from true false type of multiple choice questions to single response type, or the one best answer type, gradually from 2013. So these guidelines, I think, would also help those who are in a similar transition from true false questions to single response type of questions. So shall we? Now, these questions are also known as A type of questions, and they are very objective in nature. Now, as you see here, this is the Miller's pyramid of competencies. Clinical competence can be assessed at the two levels, mostly by the multiple choice questions. The other levels are done by your objective structured clinical examinations, objective structured long examination record, the Osler, and the mini examinations, etc., at the higher levels. Now, when we talk of the multiple choice questions, we're always thinking that our decisions based on the student's performance impacts a lot on the system. So it is very important that we make good questions. So what do we call as a good question? A good question should address only important content. I know most of us would have written the learning objectives for every lectures. So this should address the learning objective. And the question should be well structured. And for that, what is it that we need? We need to know that we have to avoid certain technical flaws. If we can avoid the flaws, then the question itself becomes very good. The other thing is we need to avoid irrelevant difficulties. Just no need to make the question more complex and complicated. Now let's see more about the A type of questions, the one best answer. Now what we call as anatomy of an MCQ or the different components of an MCQ. Now this consists of a STEM and which contains a clinical scenario. This scenario is like a short case which a student might see or a doctor might see in real life situations. So the case starts with the presenting symptoms or the complaints, and then we add some more information on the past history, a little more information on the investigations done, and then comes the treatment. So most of the information is given in the STEM. That is followed by a lead-in question, right? Then comes the options. The options will contain the right answer as well as the distractors. Right. Now this is to show you one example. As you see here on top, this is a clinical scenario where a patient with post-hepatic cirrhosis develops rapid enlargement of the liver associated with deterioration of hepatic function. Serum concentration of which of the following is most likely to be abnormal? So this constitutes the STEM, the scenario. And down below you have 4 options. Of that, 4 are the distractors. 4 will serve as plausible distractors. That is almost near the right answer. And option D here is the key answer. That is the most correct answer. That's why we call it as a one best answer type or a single answer type of a question. Now, how do we design the multiple choice question? Now, just as we saw now, it has a STEM that identifies a problem. So that problem can be from your learning objective, and it should be a significant problem. And then you have the lead-in or the key statement and the number of distractors, plausible distractors. All right. Now, one thing we need to remember about these distractors is that when we construct these distractors, These have to be in a continuum. Only then the student won't be confused. The student will be able to answer then which is the most likely, huh, and which is the least likely. It should be on a single continuum, right? Options are rank ordered in a single continuum, which shows you the least correct and the most correct. Only then the student will be able to compare the options you provide. We're coming back to designing the STEM. How will you write down the case? The case should be very clear and unambiguous, right? There is a definite problem or a scenario which you want to focus on based on the learning outcome. And all the relevant material, as I said earlier, you will have the presenting complaints or a problem, history, the past history and the recent history, then physical findings present in that case, then some lab studies, and the initial treatment. Then you can ask about further management in this case. So this type of a question will make it easier for the students to understand. Now, what is it that I have mentioned here? Cover the options rule or the hand cover test. The thing is here, the students should be able to come up with an answer to the question, even if you cover the options. By reading the STEM alone, the STEM should not be just hanging. By reading the STEM alone, he should be able to arrive at an answer. But then only we call the question is very, very clear. Same thing can be done in basic sciences also. We can use this vignette. Now, this is a question from basic sciences. Like we say, a 56-year-old man develops congestive heart failure after myocardial infarction. So the physician puts him on medications including furosemide. On follow-up, he is found to have fatigue, muscle weakness, tingling, and numbness. Which of the following drugs would resolve his symptoms while helping to treat his cardiac failure? Now, if you see the presenting complaint is there, he has developed a problem and he is put on a medication, after which he develops all these symptoms. So you're asking how to help in this, asking him to choose a option among one of these. So all are the likely options. Here, if you see that, and all are of the same length, they are homogeneous. Right? This is the most important thing we note here, homogeneous. And out of this, the best one is picked up. That is spironolactone, which is here used for hypokalemia caused by the furosemide. Right? Okay. Now, the shape of the stem also matters. Now, what you see here on top is a poorly shaped stem. Now, if you see here on top, the stem is very short, but the options are very long. But down below, what you see is the stem is longer and the options are short. So the ideal thing is to follow the one with a longer stem and shorter options. Because only if you do this, even if you cover the options, if you cover the options in the picture below, by reading the stem alone, the student will be able to come up with the answer. So we can say this type of or this shape of the stem will permit the hand cover test here. We'll see more of it in the coming slides. Now, if you look at this question, it's just one statement saying, which one of the following is true about malaria? Now, if you cover the options, there are nothing there. It doesn't answer the cover the options rule. There's no scenario and it will be just a recall from what the student knows already, right? So this we say it fails the hand cover test. Okay, there are certain things which we can avoid in the STEM, such as using the word except. Very often we see questions coming up with this type of a format, like atropine is used in all except. Now, if you cover the options here, there's nothing for the student. It is just incomplete. So we give a scenario and then give the options. So that will make the student think and answer. So the use of word except in the STEM makes the question very unfocused and it doesn't follow the test also. Okay, avoid negatives in the STEM. What is it? Like each of the following is correct except. So this is one negative. And the other type is which of the following statements is not correct. So both these type of questions are unfocused and the students will be confused. But if you really have to make a negative question, if you really have to make the STEM negative in order to examine a particular learning outcome, then you can. Exceptions are there. No, for every rule, there's always some exception. So here also we have one, like the negative word should be placed in the STEM only and not in the lead question or in the distractors. And if you say, if you keep a negative word in the STEM, at least capitalize it or underline it, because only then the student gets to notice that, right? Because in exams, students are anxious, they may tend to overlook that negative there. So please avoid negatives in this time. Use of negatives generally is not recommended, as I told you, the exception in the previous slide. So it can be a contraindication to a drug in a pharmacology question. You can say this drug is not recommended in this condition. Which of the following drug is not recommended in a particular condition? And if at all you need to use negatives in the STEM, the options, keep the options as single words only. Then the student may find it easier. Right. Now more about the STEM. We've been seeing the shape of the STEM, negatives in the STEM so far. So now, coming to the level of difficulties. Now, it should not be a recall type of a question. Go for an application type of a question. Now, what you see here is a question based on anatomy. Okay, it is just it's just the student just answers it out of remembering it. It just says which area is supplied with blood by the posterior inferior cerebellar artery. Now, can we make this question better? Yes, of course. If you link this to more information, as stated here, like a 65-year-old man develops left-sided limb ataxia, Horner syndrome, nystagmus, and loss of appreciation of facial pain and temperature sensation. You give a scenario like that. Make the student think. Let him connect the information he has already learned. And then let him come up with the answer with your lead question. What artery is most likely to be occluded? So this is an application type of a question, which is of a higher level order. Another example. See, you're just testing the facts, factual recall type of question. The first one says, which of the following characterizes alpha fetoprotein? And you're given the options down. And the application of knowledge version, you again put a scenario so that the patient student can understand better and apply his knowledge to come up with the answer. This is another question. You just ask him, which of the following is used to dilate pupils for fundus examination in glaucoma? This is just a direct question. So just a direct recall. Yeah. Now in the application version, if you see here, there is a description of a 56-year-old lady experiencing difficulties in vision for the past few months. She says she sees halos around the lights and feels a dull frontal headache. Her intraocular pressure is found to be raised in both the eyes. So, which mydriatic will be suitable for dilating the pupils for fundus examination? So, this would be a better form of a question to test application. Okay, still some may ask, why do we need a clinical vignette? Okay, a clinical vignette is introduced to the students even in the preclinical years to mimic the real life scenarios of patients. So this is he applies the knowledge of what he has learned to real life situations. That's why a clinical vignette is useful here. And you can also say it is a low fidelity type of a clinical simulation. And this will also help to improve the content validity in the exams. So that is the need for a clinical vignette, the MCQs. All the while we've been talking of the STEM. Now, how do we design the distractors or the alternatives? There are a few guidelines for this also. Now, we have been using 5 options earlier. Now, authors and researchers say even 3 options are good enough from their studies. So you can use between 3 to 5 alternatives in an MCQ question. Okay, but the distractors have to be homogeneous in content and they should be plausible distractors. The reason for bringing down the number to 3 or 4 from 5 alternatives is because most often we find that 1 or 2 of the distractors are not plausible. To make it more plausible only, the numbers have been reduced. Then these distractors, they should be similar to the correct answer in construction and length. That is all of the same length. Either because the students often guess that the long answer is the right answer. That's because when we construct the questions, when the tutor or the lecturer makes the question, we first try to put in the option where the answer is right. So we tend to put in as much information into the right answer as possible. So that makes it longer. And test-wise students can guess that it is the right answer. So it is better that we keep all the options to the same length. Right. And one more thing about the distractors is that these distractors should be grammatically consistent. They should align with the stem we have made and logically also compatible. We'll see a few examples of that where the students, test-wise students, can easily eliminate the options if the grammar is not consistent. Okay, this is another multiple choice question with a clinical scenario where a 68-year-old man with urinary symptoms is found to have a prostate lump and an elevated prostate specific antigen, that is PSA blood test. Magnetic resonance imaging suggests several enlarged lymph nodes in the lower abdomen. An X-ray shows radiolucent lesions in the bony pelvis. The patient is likely to be treated with anastrozole, desogestrel, flutamide, and methyl testosterone. So with all the information given in the STEM, okay, with the PSA raised, with the prostate lump, we could have added the PR findings also, per rectal examination findings also. That would have been nicer to this question. An MRI suggests enlarged lymph nodes, suggesting the malignancy, and radiolucent lesions will also add to clinch the diagnosis. So now the student can easily pick up flutamide for the treatment of prostate cancer in this question. Well, this is why we need to put in, we don't have to trim the STEM too much. At least the relevant information should be there in the STEM for the student to arrive at an answer. So far what we have covered is the basic rules. That is, the STEM should focus on an important concept. We are advised, it is suggested not to examine trivial facts. Many often trivial facts are put into the STEM and we get a collection of recall type of questions. Now, that is, here we need to assess the application of knowledge, not the factual recall. The STEM should pose a clear question and also satisfy the cover the options test or the hand cover test. And all distractors should be of the same length and homogeneous. If it is diagnosis, if the statements or options are regarding diagnosis, all the options will be on diagnosis. If it is a diagnostic test, all options are diagnostic tests. If it is a treatment, then it is the same for all the options. Same way for prognosis. That's what we mean by homogeneous distractors. In addition, now we'll move on to other flaws which can be avoided in the construction of the MCQs. These are the technical item flaws. Okay. What are those technical item flaws? This is one is called test wiseness and the others with irrelevant difficulties. Now let's see, what is this test wiseness? Millman, Bishop, and Eber in 1965 defined test wiseness as the student's capacity to utilize the characteristics and format of a test or the test-taking situation to receive a high score. They're not making use of their knowledge. They're very test-wise and they're making use of the characteristics or the format of a test and they guess the answer from that. They take clues from the question. And what are the types of clues? They can be either grammatical clues or logical clues and use of absolute terms or the use of a long answer as the correct answer and word repeats and convergence strategy. Now these are the things listed on. These can be easily picked out by the test-wise students. So let's see one by one. Now, if you read this question, a 60-year-old man is brought to the emergency department should be intravenous administration of. So this STEM ends like this with the preposition here. And the options are, if you look at the options, examination of CSF, glucose with vitamin B1, CT scan of the head, phenytoin, and diazepam. Now, if you look at this, when it ends with of, the student can easily eliminate administration. It is administration of, isn't it? So he will know the answer lies between glucose, phenytoin, or diazepam. Student can easily eliminate the CT scan and examination of option A and option C. Because of merely reading this, he can eliminate this. So these are the grammar clues which we can avoid easily. They have to take some extra care to check the grammar content. What are the logical clues? Now, here, if you see in this question, we see a medical doctor assessing a patient with brainstem injury. After performing the Glasgow Coma Scale, what is his next step in the assessment plan? So the brainstem injury, he reads that and then he straight jumps. He can eliminate all other things and he can just focus on cranial nerve functioning and respiratory rate. So these are the logical flows. He doesn't even have to know the exact answer. Another type of flaw is convergence strategy. Here, if you notice this question, the correct answer includes most elements in common with the other options. Now, when a patient is diagnosed as having global aphasia, the patient will be unable to. Option A says comprehend the spoken word. Option B says form words that are understandable. Option C, speak at all. Option D, if you notice, it is a combination of option A and B together. So this already contains the two options in it by itself. So this is known as convergence strategy, which is a flaw in the question, and this has to be avoided. Now coming to issues related to irrelevant difficulty. The slide itself conveys the meaning, I think, doesn't it? This slide conveys the meaning of the title. Unnecessary long and complicated statements. Now I don't think you will even want to feel like reading this because it looks so arduous. And you notice, have a look at these options. Options 1, 2 lines, 3 lines, 3 complete lines here. So options should not be complicated statements. Options should be very short. And you give the maximum. This is a poorly constructed multiple choice question considered by the medical educators. The student has to spend a lot of time reading these options. So try to avoid this type of complicated sentences as options. Then excessive wording, which is also known as window dressing. This is too much information in the STEM. Irrelevant information unnecessarily confuses students, and it is just a waste of time for them. If you look at this, 5 lines. Number of books have been published about the University of Waterloo. And these books fall into various genres, such as photographic histories, biographies of prominent people involved with the university, and accounts of the history of individual departments. Among them was a book whose author is known as Simon the Troll. What's the title of this book? And they've given the titles here. If you look at the next slide, we can eliminate most of the information in the STEM and we can just make it. What is the title of the book about Waterloo written by Simon the Troll? This is we have just condensed, or this is a gist only. We don't need this information. This is unlike the clinical scenario. Here you don't need extraneous information. This can be condensed. So that is not a very good question. All right. Now, statistics or in any department may use numbers. numerals in the questions. So here in this question, if you see, following a second episode of infection, what is the likelihood that a woman is infertile? Now, option A says less than 20%. Option B says 20 to 30%. C says greater than 50%. D is 90 and E is 75. If you look at these options, they are not written on the same lines. It should be the absolute percentage, or it should represent a range. So all the options, if you say range, if this is 20 to 30, the next option can be 31 to 40, like that. But it cannot be less than 20 in one, a range as 20 to 30 in one, greater than that, and an absolute percentage also. Uniformity has to be there for a properly structured question. This is regarding numeric data. Okay, very often we all see questions made with absolute terms. Okay, always and never. We all rarely, frequently, we see such type of words used in the questions. So in patients with advanced dementia, Alzheimer's type, the memory defect, so it can be treated adequately with phosphatidylcholine. It could be a sequelae of early Parkinson's. It is never seen in patients with neurofibrillary tangles at autopsy. Is never severe and possibly involves the cholinergic system. So this is also not a focused question. And student will eliminate this never immediately. They can eliminate these options. So never use all these absolute terms in the questions. Be very specific. Now coming to another flaw or defect is using words rarely and usually, which are very vague. They're very, very vague. Severe obesity in early adolescence usually responds dramatically to dietary regimens, often is related to endocrine disorders, has a 75% chance of clearing spontaneously, shows a good prognosis, usually responds to pharmacotherapy and intensive psychotherapy. So the student cannot come to a definite conclusions when you use these options because they make it very vague. Usually response. So we do not know the degree to which the response is found. Often related, also very vague. And usually response means there are some exceptions, isn't it? So please avoid this type of words also. Okay, none of the above has also been used as one of the options seen to be used. The diagnosis of a large ovarian cyst is most strongly suggested by an anterior dullness, a decreased peristalsis, a fluid wave, a shifting dullness, and none of the above. Why is it that we are not advised to use none of the above? The answer is it's almost like a true false question, and it generally the very knowledgeable students get confused with this type of a question, right? And the student only knows that the options are wrong, but he does not know the right answer. He doesn't catch which distractor is correct. He only knows the wrong option. And anyway, he only uses partial knowledge to score the question. And it would be a loss to the knowledgeable students, which would confuse them, this type of a question. So none of the above has brought down the validity of the test in test results. I'll show you the paper, quoted paper also is there. So we avoid using all of the above also. like none of the above, all of the above. Okay, let's say there are 5 options, and the fifth option is all of the above or so. The students can identify, if the student can identify more than 2 correct answers in that, he will most likely choose the all of the above. Or if he knows that one of the options is wrong or incorrect, then that also gives him a clue. He will know that he can rule out this option of all of the above. So these are the 2 drawbacks of all using the all of the above. There have been various studies done on the use of all of the above and none of the above. But not all educators or researchers have supported that we should give up on all of the above. There are those who still conclude, who still think that all of the above use should be permitted. So this is not very conclusive, but none of the above has been found, the use of none of the above in several studies has been found to decrease the item discrimination and the reliability of the test scores. So even if you happen to use all of the above, it is suggested not to use none of the above. And this one, as I mentioned earlier, the long option is the right option that is considered so. And I explained why. Like the lecturer writes the right option first, and then only he works out on the wrong options or the distractors. So he puts in all the information in the right answer. So that happens to be the long answer as well. So this gives a clue. A long right answer gives away the answer to the students. You also, in this question, there is also the another flaw of convergence. You see that option A, population, and then the high risk and the screening strategy. Option A, option B, option C, all have been put together here. Right? Like all of the above in other sense. Okay, same way here. If you look at this, when the patient is diagnosed as having global aphasia, the patient will be unable to, it's similar to the one earlier, comprehend the spoken word, form words that are understandable, speak at all, will be unable to speak at all, and unable to form words that are understandable or comprehend the spoken word. So this is again a convergence strategy. You see that A and B are combined in this option. This is another interesting thing we have seen in the questions during the vetting called word repeat. This we call it as word repeat. That is, a word or a phrase is in the clinical scenario or the STEM. And this is also found in the correct answer. Now, a serious complication of total hip replacement is displacement of the prosthesis. What is the primary sign of displacement? Right? Now, if you look here, the first option is also long. Pain on movement and weight bearing because prosthesis presses on nerves and muscles. Okay, that is a complication stated here. But if we look at all the options, we will notice that the word prosthesis is repeated in the STEM as well as in the right answer. So this type of a defect in the question is known as the word repeat. So we must try to avoid this type of a flaw. This is another one. Here, if you see, a 24-year-old with a previous history of chronic pelvic inflammatory disease presents with primary infertility. Select the procedure that would be most appropriate to evaluate the status of your tubes and pelvic anatomy. Now let's look at the options. Option one is postcoital test. The second one is endometrial biopsy. Third one is hysterosalpingogram. And the last one is laparoscopy with dye insufflation of the fallopian tubes. Okay, you find tubes in both the stem as well as the answer option. So this is to be avoided as well. Now we'll come to the summary of the session. Now we must make sure that we can write the item, that is the scenario. It can be answered without looking at the options. This is the hand cover test or cover the options rule. It should satisfy this requirement, right? And we put in as much information into the stem. So the student reads the information and applies that knowledge, uses critical thinking, and arrives at a diagnosis or the management, which would be in the option. But here we keep the stems long and the options to be short. And I said we have to avoid window dressing, that is, avoid extraneous or superfluous information. And we don't have to particularly make the question tricky. The idea is not to trick the students, right? So don't make tricky questions or don't examine trivial content also. It's a waste of time. Options should be grammatically consistent and logically compatible with the STEM so that we don't give room for guessing by the students. And all distractors should be plausible. I know it is very difficult to make 5 options and make 4 distractors which are plausible. It takes quite some time to make plausible distractors. But then only it becomes a well-crafted question. Now, again, we must use all the extremes. We should not be using the extremes like always, never in the options. And avoid very vague terms like usually and frequently. Please remember not to use except or not in the lead-in question. If at all you have to use negatives, use it in the stem and capitalize the words. Okay, very often we see questions made using the same language that they have given in the slide, or when they would have delivered a lecture using the same language. The same words and content will be in the question also. So don't give the exact words or the language. Paraphrase it to avoid the recall time. And most important thing, please focus on the important concepts and don't waste time on trivial facts. Testing the trivial facts. That's about the summary. I think I must thank and acknowledge all these authors, and you can use these as references. It's a very good guide by the National Board of Medical Examiners, the book written by Dr. David Swanson there, no? And Susan. So this is almost everybody uses this. Many universities use this guide. And Halladina and Downing, they've done a lot of research on these items and rules. So these papers are very interesting to read as well. There are others like Burton and Zamaro, who have also explored a lot on these multiple choice item writing guidelines. And the recent research, not very recent, as early as 2005 also, Rodriguez, as well as there's another Dr. Tarrant, right, has also examined on the use of three options. And they have claimed that three options are optimal for the use because they say the more distractors which we try to make, it becomes ineffective distractors. They actually become false statements. So that is why they've advocated three options as a rule. Um, I think I think that's all. Thank you very much for your time and patience.
Thank you so much, Prof. Chitra, for your very informative talk on the item writing flaws that we generally make and how to overcome these flaws. Thanks a lot. And I would like to request the participant to post your questions in the comment box to be addressed now. Prof, I think Renuka Devi, she says that I was waiting for this session. And a question, please do a little explanation with Bloom's taxonomy with MCQ examples. Okay, I think you have stated a lot of MCQ examples to different flaws that we make, and you explained. I think she's asking about the level of testing.
Okay. I have shown in the first line that according to Biller's pyramid, it examines only the first two levels. Maybe at a different session, we can have more elaborate discussion on this matter,
Yes.
exclusively on Bloom's anatomy.
Yeah. Thank you, Prof.
Yeah.
Prof. Razif Ali says, thank you for your clarification, Prof. Chitra. And there's a question from Prof. Chin. He has posted a question. Are MCQs a valid testing method? What are the advantages and disadvantages of MCQs?
MCQs have been considered to be quite valid because when we bring in the case scenarios, right? When we bring in the case scenarios, we are bringing to the students the simulation of real life patients. So it is not just remembrance, they just see, remember, it's not a simple recall type. When you make MCQs, as Dr. Renuka requested, if you make it at a higher level of Bloom's taxonomy, where you can apply the knowledge what you have learned, then it can be really be useful. Application and analysis. Like in biochemistry, you can use lab data where the students can be asked to interpret the lab data. So interpretation comes or answers at a higher level of Bloom's taxonomy and not merely simple recall. Yes, Prof. Chin?
Yeah. I think he cannot converse. It's only in the
All
comment
right.
box. Prof. Yeah.
All right.
Thank you for your response, Prof. So I just have one question, Prof. Now people are talking about having three options, right? One keyed response and two foils only, instead of having three foils or distractors. Because how do you think will be the efficacy of these questions? They say higher efficiency is being expected when we are using three options, because I mean fewer distractors, easy for construction as well, and reduces the reading time for students. So how do you think,
Yes.
in your view, how do you rate this three option questions?
Yeah. At our institution, we were earlier using 5 options. But we often found that during the vetting sessions and later after the exams, that not all distractors were effective.
Hmm.
So it is very difficult to make 4 distractors which are very plausible. Some of them become direct false answers only. So that's why some of these authors they have said even 3 options found. I'm not very good at statistics, but they have claimed in their papers that even 3 options are found to be very good. In this way, we can concentrate on that and then make two plausible distractors in the three options MCQ. And you can also make use of the time to have more questions examined in the session.
Yeah. Thank you, Prof. Yeah. So you mean to say, in case we move to a three option MCQ, do you think it could be a mixture of three and four, or it should be homologous? We have to be switching over to all the questions with three options.
Oh, you mean
With
some
a
with four,
heterogeneous
some
mix
with
of.
three? There are some institutes where they use four options for some questions, three options for some questions.
Mm,
They use mixed type of questions also.
okay. So in your opinion, uh, three options questions probably would have a higher uh, efficiency.
If we can make three effective or plausible distractors, then four is fine. If we can make four plausible distractors, then that is also ideal. But the difficulty is in making the plausible distractors. That is why it can be four or three. I think that is in my opinion.
Thank you, Prof. Prof, addressing to Prof Chin's question, he was asking about the validity
Multiple
of MCQs alone. So I mean, I was just
MCQs alone will not suffice, isn't it? MCQs
yeah,
will not
MCQs
alone
alone.
suffice.
Yeah, yeah.
It will
But
not suffice. You need other tools
mm,
to examine the higher domains.
domains, yeah. Yeah, okay, Prof. But when you look at the assessment, generally, if you talk about the assessment strategies, um, I feel that the assessment strategies are the ones which are directing the students, or they influence the way in which students learn,
Of course, it's
right?
always stated everywhere that assessment drives learning, isn't it? So,
Mm,
examinations and tests have a great impact.
mm.
Examinations can indeed motivate the students. So,
So based on the assessment strategies that we are applying, do you think it largely affects the way in which they um, they approach their LOs,
yes,
the students?
students will be students.
Mm.
So, they will be certainly be influenced by that.
Yes, Prof. Prof,
So, that is why we
regard.
need to plan. Yeah,
Mm. Yes, Prof.
just go ahead.
No, Prof. I was just asking about the quality assessment of the questions, that is before testing, because most of the time, like we find, I mean, we do have as far as our university is concerned, we have levels of wettings, the departmental, and then we have a central vetting with all other departments. We have different levels, but how stringent should these pre-test reviews should be to actually improve the quality of assessment? So what is your recommendation for improvising the quality of the
Yeah.
assessment?
To ensure the quality, I think it is not only the vetting. Vetting comes later after the questions are already constructed, isn't it? So the staff have to be trained. They need training workshops on the construction of questions first. Training is very important. So it has to be a part of the faculty development program, which we also do here. Prof. Hassan has done here. So we need to train the staff first, the lecturers first, in the construction of good questions. Then comes vetting. So that would make it a higher quality, and we'll be able to
Okay. So
meet the
vetting alone,
quality assurance. Yeah,
yeah, alone is
vetting
not the
alone
full
does not
picture.
suffice. Yeah,
Thank you, Prof. Thank you so much for your time. And I think, as
thank you.
requested by Dr. Renuka Devi, I think we will have a session with you again
Another
very soon.
session again. Yeah,
Yeah, with the explanation on the Bloom's taxonomy, so how to match
yes,
that. Yeah, thank you so much for your
yes.
time today, and
Thank you.
thank you so much, Prof. And I think hope to have another CME talk with you very soon. Thank you again for your time, and thanks to all who got connected with us today in this session, and hope to see you in the next CME session. Thank you.
Thank you, everyone. Thanks. Thank you, Dr. Deepa.